afternoon and welcome to today's webinar from the Mary H. Weiser Food Allergy Research Center at the University of Michigan. This monthly series was created to help patients and their families cope with the social and emotional challenges of life with food allergy. I'm the clinical social worker, food allergy counselor on our multidisciplinary team. In my role, I provide patients and families with the tools to manage food allergy-related anxiety and navigate the challenges from diagnosis through adulthood. My role was established through a gift from the Weiser Center. We're proud to provide a holistic approach to the management of food allergy. Our team is comprised of the allergists, nurse educators, dietitian, research coordinator, and myself. The center was recently named a Discovery Center of Distinction by the advocacy group FAIR in recognition of their advances into biomedical research into the origin and treatment of food allergy. Visit us at uofmfoodallergy.org to learn more. Today, we need you to contribute your questions and experiences to our conversation. Please send your questions using the Q&A function at the bottom of your screen. Dr. Sanders and our panel will take questions throughout the hour. First, I want to introduce my colleague, Dr. Georgiana Sanders. She's here today with our panel of parents and people with food allergy who will share their experiences with oral immunotherapy, referred to as OIT in our talk. Dr. Sanders is board certified in allergy and immunology and pediatrics. She served as president of the Michigan Allergy and Asthma Society and is one of the best doctors in America and one of America's top doctors. She's conducted research in food allergy, asthma, allergic rhinitis, cystic fibrosis, and pediatric home ventilation. She's a clinical researcher at the Weiser Center and a faculty member who I get to work with caring for our patients at the Michigan Medicine Allergy Clinic. She has been at the forefront of food allergy immunotherapy research and led our clinic efforts to bring OIT to our patients. We're also really pleased to have our panel of individuals with food allergy and their parents to talk to us about their experiences with OIT. We're joined by Lily and her dad, Aaron. Lily's 14 and was on the original trial for Palforzia. Hillary, whose son is 3, is participating in the trial for young children taking Palforzia. Andrew and his mom, Jennifer, also joining us. Andrew's 13 and he participated in the 14 and he participated in the original trial for Palforzia. We have a lot to get to today. So please send us your questions. We'll begin with Dr. Sanders. She's going to provide an overview for us of OIT. We're then going to hear from each of our guests on what they've learned along the way, their family's decision-making process, and ultimately their reasons for pursuing treatment. Dr. Sanders, I'll turn it over to you.
Hi, everybody, and I'm glad to be here with everybody today. Those of you who are listening in, please do send in your questions because I'm sure from what I hear in clinic, when I'm in clinic every day, people have lots of questions about oral immunotherapy for foods. And oral immunotherapy had its start in immunotherapy, which many people know as allergy shots. And the idea behind allergy shots for trees, grass, weeds, molds, dust mites is you come in, you get a little bit of what you're allergic to, and you build it up every week to more and more and more to get your body to tolerate being exposed to these things. So when we have seasons like we've had recently with the trees coming out all at once, people don't feel totally miserable. And many people know somebody who's been on allergy immunotherapy. Peanut immunotherapy is very much the same idea. You come in, you get a little tiny amount of peanut, which you take by mouth, because of course that's how we get this in. And then you take a little bit more, a little bit more, a little bit more, until you get to what's considered a maintenance dose. And a maintenance dose is about the equivalent of a peanut, which is 300 milligrams. This is done a little bit differently than allergy shots. You come in, you get a dose, there's a powder, and this is an FDA approved product. So it's, even though it's food, it's actually approved as a drug. You take a little bit in the clinic, we watch you for an hour to make sure you don't have a reaction. Then you take your pack at home, and every day you take the same amount for 2 weeks. Then you come back, get the next higher dose. Same thing, watch you for an hour, take it home, and do that. And you build up over about 6 months to get to the maintenance dose of about 300 milligrams. Why 300 milligrams? This is about a peanut, so you know you can ingest a peanut a day. This is what in studies has been shown to be protective against accidental ingestions, because that's the important thing to remember about peanut immunotherapy. We're not telling you to go out and eat peanuts and peanut butter sandwiches and peanut covered chicken. And as all the teenagers on this panel will tell you, they have no desire to do this. They're laughing, I can see them. And so none of them want to do this. This is to prevent those accidental ingestions that might happen when, as I always tell people the story, one of our patients went into a restaurant, said he was peanut allergic and ordered a bowl of chili. And it turns out this chef's secret ingredient that nobody knew about was peanut butter in his chili. Those are the kind of things that we're trying to prevent. Of course, he took one bite and realized what he had. It doesn't protect you against everything. Is to prevent against the accidental ingestion. It doesn't change your habits. You still have to carry your EpiPen or your Auvi-Q or your adrenaline injectors. You still have to carry Benadryl or another antihistamine. You still have to be careful for kids. They still have to have food allergy action plans for school. So it's really not going to change your lifestyle in a normal way, except that, as I think the parents in this group will tell you, it's consciously or subconsciously, there's a less worry when you go about your life knowing that there's a little shield around your child. I think that protects them against the accidental rock, so to speak. Most children have some kind of a side effect from it, and I think I'll let Lily and Andrew talk about that, but the most common thing we see are itchy mouth and throat, very common to have, and that goes away with time. And we see this also with other forms of oral immunotherapy, like to dust mites or trees. People get itchy mouths, so it's not just the food that causes that. You can get an allergic reaction, which is one of the negatives about this product. And then there's another negative, which is called Euceneophilic Esophagitis, which is a very small group of people, only between 3 and 8% of people in the trial had any symptoms of eosinophilic esophagitis, which is an entity where you get stomach pains, may have some significant nausea, vomiting. The eosinophils, which is the allergy blood cell, actually start lining the esophagus. They don't normally go there, and they think they're getting contact with the food. When you stop eating the food, all those symptoms go away. So it's not anything that's going to be permanent, but it is something we always watch for, because we don't want somebody to really go on and develop full-blown problems with eating with that. So we will stop the product in that situation. The product is now approved for children from 4 to 18. Over 18, it has not been approved. And under 4, it's not yet approved, but children like Stevie are in trials right now, and these kids are doing fantastically with the product. And so I think it'll go through very quickly once we get the trial done. We are all, I should know that we are also offering peanut immunotherapy off table to some of our younger children because they can't get Palforzia, and the trial is now close to, the younger child trial is getting closed very soon. This is where we start with either peanut protein in peanut butter, peanut flour, or Captain Crunch peanut cereal, which we actually use for these kids. And we start again the same way, very low dose and build up gradually. But it's with food products instead of an approved drug, because of course, Palforzia is peanut product. It is a food, but it is FDA approved. So we are starting to offer that in the clinic also for the younger children. And I think that's kind of a really quick summary of Palforzia, and maybe Kim, we should go on to talk to some of the people who have actually been through this process and see what they have to think.
Dr. Sanders, we already had a question, so I know it's something we wanted to address. What determines if a patient is eligible?
So you have, first of all, age. You have to be between 4 and 18. You need to have history of peanut allergy, and that's usually determined by your doctor. The doctor would normally refer you to the clinic for peanut immunotherapy. If you have severe asthma that's not in control, you're not a good candidate, because obviously we're giving you something allergic to. We don't want to make your asthma out of control. If your eczema is very, very severe and not in control, we would say don't get started, get your eczema under control. And if And if you have a history of a lot of stomach problems or concerns about your ability to tolerate foods, we may say, yeah, that's not the best therapy for you. Obviously, any other major medical condition that would interfere with taking this, but those are the big ones.
Is it appropriate for people who have multiple food allergies?
It will only help peanut. It won't help anything else. So yes, it's as an option, it is appropriate for peanut allergy, but you have to understand that it's not going to change any other allergies.
Excellent. So we have already had 2 people ask, with multiple food allergies, would that exclude us? So it sounds like no.
Not excluded. No, not excluded. But it won't. But the other food allergies won't be helped.
Okay. So can we start with hearing from you, Hillary, Hillary is the mom of 3-year-old Stevie, who is not with us because we wanted Hillary's full attention and she wanted to be able to give us her full attention. So Hillary, can you tell us about your family's experience?
So it went really well. I don't know if ours was a little bit different because we started out first with, we weren't sure if we were on a placebo or the actual product, but then it did turn out that we were on the actual product. I think we started in 2019 when Stevie was actually just about to be 2. So we've been doing this for a while. I knew once I found out that Stevie had a peanut allergy that I wanted to get him into some sort of immunotherapy, and I'd heard about the patch studies before, but we were introduced to the oral immunotherapy study once we started looking into things. And I thought it sounded great. It was a little bit challenging starting with a kid that young, I would imagine, just because getting him to eat things in general was a little bit difficult sometimes. And he couldn't communicate what it was making him feel like, if it was bothering him, if he thought it tasted gross, or if he was just being a 2-year-old and didn't feel like eating food right then. But overall, it's been a great experience. The appointments weren't particularly terrible or anything. They can be a little bit time consuming, but Stevie's handled it all just fine. At this point, he's going to be 4 in July, and he's used to taking his medicine every day. We tend to mix it into yogurt or applesauce. And then I'm seeing a question, I don't know if this is specifically for me, about extreme anaphylaxis. Stevie hasn't had an anaphylactic reaction. We found out he was allergic to peanuts because we gave him a little bit of peanut butter as an infant, the same as we had done with my older son. And Stevie, oh, sorry, that's for you, Kim. In our case, he hadn't gone into anaphylaxis. I don't know if that would have changed opinion or not, but it seems to have really done a good job of increasing his tolerance. The first time he had peanut butter, he basically, I describe it as the scene from The Exorcist with the projectile vomiting. It was quite something. So we haven't had any more experiences with that, and we are pretty sure that he's had some accidental exposures and it hasn't been a problem. Like, we've never had to use his EpiPen.
Thank you. And so it sounds like it was an easy decision for you. You knew right away when he had his diagnosis that you wanted to pursue treatment if you were able to.
Yes. And we've just been generally fortunate as far as his particular allergy seems to be fairly mild, all things considered. We still have some peanut butter in the house that we keep up out of reach, but my older son likes to eat it and we still eat it. So it's not one of the allergies that it's so bad that he can't be in the same room with something. So it's given us more peace of mind. I would say that it has gone a long way towards that.
Oh, thank you. Thank you so much. We're gonna.
You muted yourself.
Kim, you got mute on. Mute went on for some reason. I don't know why.
Yeah, I was trying to be so polite and I overmuted. So I'm going to turn it over to Erin and Lily to tell us about their family's experience.
Okay, my daughter had to show me how to unmute it. Hi, everyone. I'm Aaron. This is Lily. Lily was diagnosed, I think like 6 months old, maybe even younger, with food allergies, one of them being a peanut allergy. And Lily's is very severe. Lily can't be around it. She can't be around the dust. She can't be anywhere near peanuts. And so at a young age, with her in the house, my wife, her mom stayed home with both kids while they're young. It was scary but manageable in the beginning. But once Lily got to be school age and kindergarten and getting a food allergy action plan together and the peanut-free table and all the steps you need to go through, then it became much more scary because obviously you can't control what's happening at school. And so when Lily was in, I think, second grade or third grade.
Second or third grade, yeah.
We had a chance to get in the study and we jumped at it. We were very excited, very thankful all these years later that we had the chance for it. And she was also in that very first year where we didn't know if she was getting the real product or not. And unfortunately for Lily, she wasn't. She was getting the placebo the first year. And then the following year, she started with the product. And she's been doing it ever since. And it's changed our lives. It's changed her life. And so obviously it's always still in the back of our mind. We still have to have processes in place and protocols, and our friends and family are very supportive and they understand the severity of it. But the fear factor is so much reduced by knowing that every day, we call it the peanut medicine. Every day she takes her peanut medicine. It's 300 milligrams, as Dr. Sanders said. And knowing that she consumes it and does it fine, as a father, it makes a huge difference. Anything you want to add, Sweetie?
No, I think you pretty much covered it.
And what about taking it every day, Lily?
Yeah.
I mean, obviously I feel super fortunate to be in the study. I mean, it's been such a blessing. Taking it every day can be difficult for me to remember and plan out my day for when to take it, because there's certain rules, like you can't like work out before 2 hours after, and I'm a competitive swimmer, so that's a problem. And just I can't take it too early in the morning and all of that. So remembering to take it and planning out my day can be, a little frustrating, but it's definitely worth it.
And tell them how you think about the actual taste of it. Do you like the taste of it?
I hate the taste of it. I've always really hated the taste of it. I think just because I'm allergic to it, and like whenever I smell peanut butter, I can't. It just grosses me out. But yeah, I definitely do not like the taste.
I'm sure that parents and maybe some of the kids will want to know, what do you do to help yourself with that? Do you hold your nose? What do you do?
Oh yeah, holding your nose really helps, because like smell is a big part of tasting things, but I also try to do like strong yogurts that kind of can try to hide the smell, or like do something with a lot of texture so I can't tell the powder's in there. That definitely can help.
Oh, great ideas. Is there, if there's a parent listening and they're really excited about pursuing, and their child maybe who's your age or younger is really afraid, what would you say to them about, what?
I would probably say, I mean, when I first started the study, I was really scared, because I was like, I'm taking what I'm allergic to every day. I don't see how that's going to help me. But it definitely changed my life. I mean, I can do so many things now that I couldn't when I was younger. Like, I don't have to worry about peanut-free table, or like when we go on airplanes, that's not a worry anymore. But definitely it can be a little scary the first few months taking the peanut powder. And I think I've only had one big reaction to it. But otherwise I've just had tiny ones, like my throat's itchy. Maybe I'll take a little bit of Benadryl, but otherwise I've done pretty well.
I would be really interested. I want to come back to how you learned to distinguish. Sometimes when I talk to people, it's hard to distinguish between, is this my worry or like my anxiety about having a reaction, or is it a reaction? So if you can kind of think about that, how you helped yourself determine, like, if I'm feeling a sensation in my throat, am I having a reaction, or is it I'm feeling, a little nervous? And so how do you differentiate? But I'm going to ask you to think about that, and Andrew as well, just because I think that's a common concern. How will I know? And I'm feeling anxious, so how will I know if I'm having a problem? And can I invite Jennifer and Andrew in to speak with us and tell us your story?
Yes, you can.
Thank you. Hello.
Hi. So I'm Jennifer, this is Andrew, and we joined the Palisade study when Andrew was in 2nd grade. So he was 7, I believe, when we joined.
Something like that, yeah.
7 or 8?
I think he was 7.
The other day. I
And
think
you
I
were
was 8.
Okay.
I just turned 8.
Yeah, okay.
So he's 13 now. So we've been in the study for we were in the study for about 4.5 years, and he's been on maintenance with Peanut for 5 years. And I decided to join the study because Andrew,
We decided.
yeah, excuse me. We decided to join the study because Andrew was having anxiety at school and at different events where people were bringing foods and he had to sit out. And it's just anxiety inducing being around Peanut when other people were eating it. And Andrew is ingestion allergic, so he doesn't necessarily have a reaction when he's just around it. He has to eat it. But he remembers a very severe reaction he had for accidental exposure.
I remember it too well.
Yeah.
Well, I don't remember it. I remember the dream I had that night about it. But
Yeah. So the exorcist example of projectile vomiting and everything that went along with it is very seared in our minds. And I've never been so scared when that happened to him. So that was I think you were about 5 when that happened. He was
really? I thought I was 3.
Well, you were diagnosed at 3.
Yes, and then I had.
Yeah.
Whatever.
I don't remember.
So that detail wasn't important,
No.
but he definitely had anxiety regarding being around peanuts, and
Still do.
yeah, and so we decided to join the study, and I think for us it has really changed what we feel like we can do. We've not had fear of traveling, which was important to our family, so we have traveled quite a bit since then. Well, maybe not this year, but in the past we have traveled a lot, and it's helped us because it's often very difficult to determine where it's safe to eat. And even though you ask those questions at restaurants, you still have to be careful and you still have to ask, but it just gives that extra layer of protection that, you're not quite as nervous when you go out to eat or when you're in school.
It's
or
quite convenient.
Yeah. It's very nice not to be terrified all the time.
So Kim, can I jump in for a second?
Please.
So Andrew actually had a reaction, or we aren't sure what he had in the trial. And so maybe you could talk about that a little bit and the surrounding, like what we finally figured out around that event, because that is important for people to hear about somebody who had some kind of a reaction.
Okay.
If it was a reaction, we're not even sure.
Yeah, we're not exactly sure, but we were in the maintenance phase, and one day Andrew said, I don't feel well after taking his dose. And
I don't think I'd actually, had I taken my dose?
yeah, you took your dose.
You took it and you didn't eat.
Yeah, and
You
then
didn't eat dinner.
Yeah, I didn't eat dinner. It was,
Right.
I think it was around the 29th of December. Don't ask why I remember that. I just do.
Traumatic experiences we remember.
It was 28th. It was in
And-
December.
Anyway,
He had the dose and he didn't want to eat dinner, and he ended up vomiting, and he felt really ill, and we ended up using the EpiPen and going to the ER.
Thing was Navicu.
And he ended up vomiting again in the ER, and they weren't sure whether it was anaphylaxis or whether he was sick. And we were there all night long monitoring, and it ended up that he developed a fever while we were at the ER. So we aren't really sure. And that was one of the hard things about not knowing, is this a reaction or is he sick? And I guess we still aren't sure.
now I don't know if the reaction was because he didn't eat and was getting sick. If it was
Yeah.
a reaction or if it was early, but he was sick for a couple of days after that. I
Yeah.
remember. And so we decided, yes, he definitely had a viral gastroenteritis. But and this is, I want to bring this up because, there still is a potential for a reaction, they ended up using the EpiPen. He did fine. And none of us are still sure in our minds whether that was a reaction or whether it was the first beginning of getting sick. But it was a setup because he didn't eat his dinner, and we always want you to take it with food to prevent allergic reactions. We want you to make sure that you take it about the same time, no exercising. And as Lily said, that's been hard for her as a competitive swimmer. You know, she swims twice a day, right? Are you still swimming twice a day with school on? In the summer, I know you do.
Yeah, definitely. During the summer, I was swimming like twice a day, and during school, when I had school swimming and club swimming.
Yeah.
But right now I swim only once a day,
Okay.
so that's a little bit better.
But these are issues that you have to work around. And when you're thinking about going into immunotherapy, there are things you need to think about. So I wanted to emphasize that for what Andrew had gone through, because I use you as an example when I talk to people about going on to immunotherapy. You know, this is what can
Tricky
happen.
just because I sat there thinking, should I use the epi? Is he sick? I'm not really sure. And I just erred on the side of
Which
it's
is right, which is the right thing to do.
And
Yeah,
I
it's always the right thing to do.
called. I don't
Yeah.
remember whether it's the hospital, the ER.
Yeah, we
the-
called to make sure, and
We did, yeah, and we said use the epi. But
Well,
the other thing that Andrew has done, and Kim, I don't know if you want to go here right now. So Andrew, why don't you tell them what you came to me with last fall, you and your mom?
We quit out of the study. It was really just getting too repetitive. And it just taking the exact same thing every day and every day. It was just beginning to be annoying. It was getting hard to remember. That still doesn't help, but still it is.
it's always hard to remember to take it every day, regardless of what it is.
And it was just
So he actually left,
like we needed.
and what did you do?
We started taking, I think we ended up starting on 3 Reese's Pieces and then slowly updosing to 4 or 5 and now 6, which I've been on for a month or 2, maybe.
Yeah, about that.
Ish.
Yeah.
But it's ended up being a lot easier. Still doesn't taste good.
He still doesn't like it. So don't get excited, Lily. He still doesn't like it.
I think no matter what it is, they're going to hate the taste. I mean,
It's
Now, and I will tell you, and Hillary can tell you this, that's not why Stevie doesn't eat it. Stevie doesn't eat it because he doesn't feel like eating whatever it is that day. And so we're seeing the young kids, I don't think, really have the negative reaction to the peanut that the older kids are having. It's interesting.
He's not a huge fan of the flavor.
Okay.
That's become more obvious since he's gotten older and better able to articulate it. But I don't think it's quite as much, but I don't know. It's a little hard to converse with him about it. So
Okay. So
Hillary, what is Stevie's response when you give it to him to take it?
So we have different things that we will mix it into. So generally we try to, and sorry, I have a Zoom thing on my other phone. My husband's probably going to sign in a minute to take over for me since I have.
Please jump off. We know you have a
But no, so we have a few different things that we'll try to mix it in for him. So generally yogurt because he loves yogurt. So, and that's easy to blend it in with other stuff, and a lot of applesauce. But if he's feeling really cranky about it, we'll do pudding. So it really kind of depends on what medium we're mixing it into. He does eat wow butter. So if we're giving it to him like at lunchtime, we'll just mix it right into the wow butter and then he doesn't really notice. So that's been.
You've had to get creative in response.
Yes.
To maybe he doesn't want to take it that day. Yeah. Thank you for sharing all of that. Yeah. That's really helpful. I know you've got to go into a meeting and I know your husband might be joining us. Feel free to jump off if you have to. We really appreciate you being here.
Okay. I should be good for another couple minutes, but thank you.
Excellent. Okay. Thank you.
Can I hear more, Andrew, from you about, what we were talking a little bit before we started taping, but what for you, your hopes for how this might make things easier for you as you get older. And I'd love to hear that from both Lily and Andrew about, what is my hope if I did this now? And it's a lot to take on, and I have to figure out all the details. But what I'm hoping for is, like, when I go to college, that life will be easier, or as an adult, sort of what were your hopes in terms of how your life might be changed as a result, either of you, of taking part in OIT?
Well, what I was saying earlier was it will eliminate a lot of the what ifs of, oh, well, what if this place has it? What if this place has it? What if this happens? Whatever, what'll I do? It just eliminates a lot of that, not all of it, but a lot of it. And it will just make navigating life in general a bit easier.
That makes a lot of sense.
I don't have to be I don't have to be cowering in fear because I might step outside and there might be a peanut looking at me. Or
That does really paint a picture, doesn't it? Yeah, that makes a lot of sense. Just the unexpected, but also, as you get older and you're living more independently and you're in situations in which you don't have the same kind of control over what everyone else is doing, it sounds like you're hoping that will give you more ease around that.
more room to, I think you said earlier, wiggle room.
Yeah.
And just make things easier, really.
Lily,
did you have some thoughts you wanted to add on that?
Sure, yeah. So I just think as I get older, it'll just make handling things so much easier, like going into a restaurant with my friends and not have to worry about like what they order. Or, when I'm in college, oh, my roommate has peanut butter, like that's okay. And especially when I won't be around my parents who can kind of help and direct that kind of thing, like I won't have to worry about whether or not, like, if I have a reaction, I'll still have one, but it'll be way less severe than it normally would.
And also, since she's been in the study, she's been on the maintenance dose now for a few years, I forget how many years, but she does things now that she could never done before. She's been to camp twice. She goes to weekend retreats. Next weekend, she's going down to visit her grandparents with her friend, flying by themselves in the airplane, things that could never have happened before. So it does open a lot of doors now as well.
Oh, that's really a good point. Just your independence now, things you get to do as a teenager, sounds like, things that maybe you wouldn't have been able to do, or so you wouldn't be getting those experiences of that practice to be able to do it later in adulthood. How do you feel when you do these things by yourself now? When you're out with your friends or eating without your parents?
Yeah, I mean, sometimes I still get a little nervous, like making sure like a restaurant or whatever knows that like, I have food allergy and everything. And especially I had a bigger reaction to the peanuts a few years ago. So a few months after that, every time I would eat, I would get super like paranoid that I was eating something that it wasn't supposed to be. But really, after that, I've been super comfortable just being able to hang out with my friends and not have to worry about to like let the parents know before time to like put away all their peanut butter and stuff. It just makes like everything so much easier, and I'm a lot more comfortable now than I was before.
And it makes your day-to-day life less about your peanut allergy.
Yeah, definitely.
Oh, that's an excellent point. Yeah, so just you get to focus more on the things you're doing rather than how I'm going to do it.
Yeah, exactly.
I wanted to also hear, Lily, so you do have this, you did earlier 2 practices a day, and we had talked about you can't take the medicine and then exercise, immediately. How did you navigate it then? Because I've talked to some kids who are student athletes and they wonder how they will work that out.
Yeah, okay. So for like I had during the summer I have practices at like 7 a.m. So I'll just take it afterwards. Like after I take a shower and everything, I'll just take it then so I don't have to worry about taking it beforehand. But before I would take it right when I got home. So I had like 2 hours before I would start swimming. And if there's ever a time when I take it and I don't have like exactly 2 hours, I start out slow and just make sure that I'm feeling all right while I'm doing it. And if I am, then I'm just gonna keep swimming.
And there have been a couple times when we're pretty rigid with bedtime, but the only time to squeeze it in is kind of later in the night. So she gets to stay up and watch some TV or a movie with her dad while we're waiting for enough time to go by before she can go to bed.
So we'll put that down as a benefit.
Yeah, there you go.
Extended bedtime. So we have a question. Let's see. My son is afraid to try OIT because he thinks it will make him feel sick and have reactions daily. What would the panelists say about this?
Well, I would say, I mean, at the beginning, I had a lot more reactions, more just itchy throats, but now I really I just got a system going. I did have a reaction where I took it in some wow butter and it got stuck in my throat, and I caused a reaction then, but otherwise I'm pretty much reaction free. Like I'll eat beforehand to reduce reaction possibility. I'll drink water just to wash it down, but I would say that you're starting out with such a small dose that the chances of having a large reaction are pretty small.
Excellent point.
If I just speak to the dose, Kim,
Yeah.
a peanut is 300 milligrams about of peanut protein. And the dose that gets started after there's an initial escalation day where you go from half a milligram to 6 milligrams. So we know you can tolerate that much. And then you go down to 3 milligrams for that first week. So you're to 6 to 3 milligrams. You're taking basically 1/100th of a peanut when you start out. So it's a very, very tiny dose.
I think this is a question for Stevie's dad. Dave, thanks for joining us. We have a question. How do you handle the rest period with a toddler? I'm thinking about starting my 2-year-old. We'll hand that right over to you, Dave.
So we do target him having the peanut protein at dinner time usually. If for some reason we have a day where it looks like dinner time isn't going to work, then I try to do it in the morning. So we don't normally have lunchtime be the time that we have to do that. And we're also kind of, for better or worse, he does not take naps particularly consistently. So it's largely a problem we haven't had to solve. But by targeting evening, it tends not to be a problem.
We have another question, Dr. Sanders. My daughter is 6 months old. At what age would we expect to be able to begin treatment?
It is a 6-month-old already had a reaction to peanuts. That I guess would be my first question. because oftentimes parents have asked about the age at which they're starting it. We are starting some of our young children with a documented peanut reaction on off-table peanut immunotherapy at that young age. Now, the research protocol is only allowing us to start it at 1, between ages 1 and 3, and that's soon going to be finished. But because so many children are getting peanut introduced at a young age, because of all the information that's coming out about introducing foods early, we are seeing younger children have peanut reactions, and we have been starting the children under 1 year in off-table immunotherapy.
We have another question about, did any of the patients experience stomach discomfort? And if so, what helped?
Did either of you experience that? I don't think you guys did you?
I mean, when I really had a reaction, I think.
When you had the reaction, but other than that.
Like just regularly when I take it, no.
Yeah.
I mean, only occasional itchy throat-ish and other things regarding the throat. That was really the only thing that I had personally. So
He got a little bit flushed, which is obviously something he wouldn't have noticed. I noticed it.
I can't look at myself.
Yeah, but the throat, he complained of a lot. And
Ah,
drinking a lot of water and apple juice was really helpful, and it went away usually quickly.
so I want to come back to that question of, so how did you begin to understand, Andrew and Lily, like, okay, if I'm feeling that in my throat, how did you stop yourself and just sort of observe and not just instantly panic that I'm having a reaction? How did you learn to do that?
At the beginning, I instantly panicked.
Sure.
I'll be honest. I didn't stop and observe. I just panicked. That's all I did. I mean, now I don't really feel anything.
How did you learn? What do you do now that you didn't know how to do then? That helps you with that.
Drink a lot of water. That seems to be the only thing that works and the only thing that needs to work.
I think it helps that you got used to taking it every day and knew that it wasn't going to be a full-blown reaction. It's just, this is a passing symptom. And
Oh, good point.
in the beginning, though, you're eating the allergen. He was young. I understand why he was scared of what might happen, because you could feel something was wrong, is what the way he described it.
Yeah, I just feel that I was having something. Couldn't tell what, but I was having something. I mean, at the time I was 8.
Was there any point you wanted to stop because you just thought, I don't like that, I don't want to deal with it at that point when you were 8?
Yeah, probably.
So how did you encourage him? How did you help him work through that? Because I imagine that could happen for a lot of people. I just want to stop. I don't like this. I don't like that feeling.
It was difficult as a parent to watch that. Like, I hated seeing the fact that he obviously was in distress, even if it was minor. But I think working through it over time, knowing that he was going to be okay. And to be honest, those reactions were a very short period of time in the 6 months. So I think you just have to work through it, knowing that there were to be expected some symptoms. But it was a short period of time, and now, we don't experience anything like that.
Is there anything that sounds familiar to you, Erin and Lily, about what you hear them say?
Yeah, so whenever I start to feel like I have a reaction, I just take a step back, think for a second, be like, okay, is this just like my thinking that I have a reaction, or am I actually? And pretty frequently I just have like some itchy throat. So what really seems to help me is I like to gargle salt water. It just kind of gets everything, all the peanut powder that might be stuck in there, just out, and then pretty right away, like my throat will feel a lot better. And then definitely at the beginning of the study, I was like, my brain was freaking out. So I kind of not made up, but I thought I was having reactions when I wasn't. That was definitely a problem. But now I've learned to take a step back, think about it, make sure that like it's just not all in my head.
If there was a benefit to getting the placebo the first year is, if you were to go back and look at the journal from the first year, which we haven't done obviously, but my guess is there'll be several times she said she was feeling something and, but she wasn't. It was all psychosymptomatic. And so I think that kind of helped her realize, okay, I may have symptoms and they may be real symptoms, but to differentiate between what she thinks she's having and what she's actually having.
It's an excellent point. I think
Kim,
that will help a lot of people. Yeah, sure.
I'll talk to that in a second. So the mind is very powerful, and there's more and more research going on in the connection of the mind and the gut in food allergy. But we did have one of our other participants in the trial, the whole first year when she didn't know what she was getting. She would come in and she would, every time she took the new dose, not when she took it home, but that first day in clinic, she would get a headache and she'd get 1 or 2 hives. And they never progressed. And so mom just started bringing Tylenol and antihistamine and would give them to her after she took it, and they would go away. She was on placebo. And when she actually got flipped onto the product, she had absolutely no trouble with it whatsoever. And it was more like, and as Lily, I think Lily eloquently said, is that unknowing, like, what am I getting? What am I doing to my body? And she can laugh about it now. She's actually a college swimmer. She swims in college now, but she laughed about it. But it's very powerful what your mind can do. And learning to control that is very important.
Oh, so I think that's going to speak to a lot of parents and kids out there who, I think that might be one of the biggest perceived barriers, is how will I cope with it emotionally? If I already have anxiety, is it really going to exacerbate it? If I feel okay now, why would I do that to myself? So I think that's all really helpful to look at, and to be able to, if you are experiencing difficulty, remember there's help. So in my role at our clinic, I meet with people who are starting OIT and really talking about how to kind of think your way through those moments, because those are all normal things to experience. And it is, I think there's a learning period of adapting and adjusting to, and then learning those coping strategies that both of you mentioned, in terms of how can I keep getting through this. Just because I feel afraid at this moment doesn't mean I'm not okay, and it doesn't mean I have to stop making progress. We do have a question. Once you get to the maintenance dose, do you continue for the rest of your life?
At this point, yes. So you continue, and one reason I wanted Andrew on the panel is I think that we are seeing some people. We've been on palforzia for a long time, and as the study, work is kind of slowly winding down, not winding down yet, but as people are in different waves leaving, and Lily, you don't have to leave soon, don't worry. But different groups are leaving the study. They're kind of asking us to continue following people for a year and see what people decide to do. And I think some people will continue to stay with the product because you know what you're getting. I think some people will make a decision like Andrew made, is let me try something different. Yes, I know it's going to be able to build up again, but I want to do something different. And some people will go off. What we do know so far is that if you go off of oral immunotherapy within 3-4 months, you do no longer have what we call sustained unresponsiveness. It doesn't stay with you. Now, what we don't know, and what's going to be looked at, of course, is if you're on it for years and years and years and years, does that change how you react? Because, of course, most of the trials that were done before this big trial were small, and they may have followed somebody up for a year or two, but not 5, 6, 7, 8, 9, 10 years. So then they were all small numbers of people. So we'll be learning more about that as people, come off the product. How do they do? We also don't know the young children like Stevie, where the immune system is not mature yet, where we really think we can modify the immune system more, which is why we're all focusing on this young age now. Can we get these children to a point of sustained tolerance where they cannot eat something made out of peanut every day, where they can eat it 3 times a week, 2 or 3 times a week, because anytime anybody's had an allergic reaction to a food, say milk or egg, which children often outgrow, if they outgrow that, we still say, make sure you keep this in your diet. Don't go away from it. Don't lose the tolerance that your body has to this food. So I'm not going to say, go off of it and then come back again in 5 months and try it. But, can we have a little less rigid of a schedule? Perhaps as we go along, but we still don't know that yet.
So does the maintenance dose always require the 2-hour rest period? And what is rest? A parent would like to know.
Rest isn't, normal heart rate. You can go out and take a walk. You can, go do errands. You can go about your normal life. Don't go out on a 10-mile bike ride or a 20-mile bike ride. Don't go swim 50 or 60 laps like Lily does. Don't really exert yourself for that 2 hours.
Do you need, I'm sorry.
No, good.
Do you need to start over with dosing if you have a reaction or feel sick?
Well, everybody's individual. It depends on where you are. If somebody has a reaction like Andrew, actually, once he got better, we just put him back on his 300 milligrams and he went on and had no trouble. So once you're on maintenance, it's not quite as crucial. We do tell people they can miss a day. They can miss 2 days. After 48 hours, we ask them to call us, particularly during the build-up phase. And we don't encourage you to miss that. But if you're sick and you need to stop the product, because when you do get a significant illness, not a little runny nose, type cold, but if you have a fever, if you feel ill, we do take you off the product for the time that you're ill. And you can come back into it up to 72 hours later at the same dosing. But if somebody's very ill, they miss longer. We had one child, well, Stevie too was hospitalized, right? Yeah, so you want to talk about that? Because Stevie was hospitalized for pneumonia, and we had to drop down his dose, basically what we did. And then we built back up again. And then that happened to 2 of our children, actually the same year. It was a very bizarre Christmas time. They both got really sick and ended up in the hospital. So you don't have to start over necessarily, but there's an adjustment made for an illness. if it's prolonged.
So since we only have a few minutes, I'd love to turn it back to our panelists and just hear, maybe starting with Lily and Aaron, and then hearing just if there's anything else you think you would want people to hear about your experience, or what would you tell people who are thinking about OIT?
Thanks. So, as I mentioned, Lily's has it's on the severe end, her allergy. It's a pretty concerning, strong allergy. And so, thinking back to when she started kindergarten, for example, she's in school all day long in the peanut table, and they had a, sign on the classroom, no peanuts allowed in the classroom. At that point, Lily was a peanut kid, right? She was a peanut kid who needed special attention. And through this process, she's now a kid who happens to have a peanut allergy. And that distinction where now she goes about her life. I mean, she swims, she's in theater and lots of activities, and she's just a kid who has fun, and she happens to have a peanut allergy that requires her to take this daily dosage. And the peace of mind my wife and I have from that, and Lily and her friends, I mean, I can't say it too strongly. It's been life altering for our family. It's been a real blessing.
Did you
And they travel a lot too. So
Yeah, I mean, so a couple years ago, we were fortunate enough to be over in Italy, and when we were in Venice, we stayed in a convent, and so the nuns let us use their fridge to store the peanut products so it could stay the right temperature. So that peanut product has been, all over the world with us.
Yeah.
Lily, is there anything you'd want if there's kids listening to us?
I would just say that definitely in the beginning, it can be scary, and it can seem like, well, why am I doing this? Sometimes it seems like it's not worth it, but it totally is. Like, I can do so many more things now. And yes, it has a few downsides, like having to think about it every day. But like that also means that I don't have to think about it when I'm going to my friend's house and stuff. So I would say it's definitely worth it if you're considering.
Thank you. And Jennifer and Andrew, what are your thoughts? What would you want to summarize?
Well, I can really relate to what was just said about having the peace of mind when he goes over to a friend's house, because when we started, he wasn't really going anywhere on his own. But now that he is, I feel as though, I have less anxiety when he's by himself. I know through the trial, he's learned how to use the ABQ on his own, which was a huge deal for us. I worry about that a lot less. And just the layer of protection that he has, I don't know what his friends are eating or whatever. I know that he knows to take care of himself, but it's just that extra protection. And our trial product also went around the world with us. So we understand what that is like. And we did do one very exciting vacation that I never would have tried had we not been on the product. We went to an island in Australia where it would have been difficult to get help, but not impossible. But I felt like we could tackle something like that we had always wanted to do. And I never would have done that before. It's a long flight, all those kinds of things. So
It's worth it.
Yeah, it was worth it.
Although
Was it fantastic?
stuff on the island was a bit of a pain.
Yeah, that's true. That was tricky. Finding
keeping it
something
cold.
to mix it in was a challenge.
That's right.
It was one of the reasons why we decided
That's right.
going to Reese's Pieces would be so much easier for us, because
Sure.
butterscotch pudding did not go over well on an island.
No, it was like, and then there was like,
Yeah.
I don't want to think about it. It was disgusting.
So there are ups and downs to that.
Yeah, it's opened up a lot of opportunities, it sounds like, for you as a family too.
Definitely.
And Dave, you're going to finish us up. What would you tell people with younger kids from your family's experience?
I think it's made it, I largely echo, it's a lot of peace of mind, especially with as young as our son is. Like, we had very little problems with him being concerned about his health. He just didn't understand his peanut allergy at all. So it has been fairly simple. The hardest part is like finding the right thing to mix it in, because his tastes change every single day. But as far as like him even noticing that he took it, he has never once complained about taking it. It never makes him feel particularly funny. He's never complained about his throat. So it's been absolutely wonderful as far as we're concerned, other than just like we have to remember to do it every single day. But it adds so much peace of mind just when you're out and about and have, you know, your kids going places. It makes it so much better. It's so much less to worry about.
Thank you. And thank you to everyone who joined Dr. Sanders and I so they could hear from you, and instead of just us, you know, talking about your real life experiences. And we are at the end. And so we always end with a mindfulness practice. So I want to bring us back, just stopping for a moment, kind of tuning from our thinking brains, and just let's find our breath and take a couple good deep breaths, and using that skill of coming out of our thinking and just becoming a curious observer of ourselves. Take a couple deep breaths, breathing in from the top of your head down through the soles of your feet. Continuing to feel your body breathe, and setting aside any thinking, just noticing how it feels to breathe. Feeling the fullness of your inhale and your exhale. And remembering that your breath is always with you. And in these moments, as we heard our panelists, you know, there are moments that you could feel stressed in dealing with food allergies. But we also know that we can use our breath, we can use our mindfulness, our ability to stop and pause to help ourselves respond rather than react. So on behalf of the Weiser Center, we thank you for being with us today. Please stay with us and tune in, because May is Food Allergy Awareness Month, and we have 2 webinars planned for you. May 6th, we have a parent roundtable. One of our featured guests is Denise Bunning, who is one of the co-founders of MOCA. And we have another webinar at our regular 3rd Thursday, 1 to 2, and that will be a celebration of food allergies. And so we really look forward. Also tune in. We have some special surprises during the month of May with some of our food allergy patients and parents, making some short videos to share about life, you know, a day in the life of my food allergy. So thank you, and we look forward to you joining us again. Always check out, we've got a YouTube library now of a year of videos about everything pertinent to food allergies. You can find those and you know, share them with others who you think you want them to be more familiar, and so that they can also be supportive of your family. So thank you, and thank you, Dr. Sanders, for joining me. Have a great day.
Thank you, everybody. It was great fun talking. Bye.
Bye, everybody.